Okay, with us today is Lieutenant Governor Gilchrist as our special guest. Lieutenant Governor, thanks for joining us.
Yeah, my pleasure. Happy to be here with everyone. Hope everyone's staying safe.
We're all trying through these trying times, so we will get right to our questions. The first question for today is, you head up a task force that is looking into the racial disparity impact of COVID-19. Can you give us any insight on the objectives of the task force and what you've learned so far?
Yes, the objective of the task force is really simple. We are looking to recommend actions to directly address the racial disparities when it comes to the mortality rate of COVID-19. What we have seen already is, based on the fact that the state of Michigan was one of the first and is still one of the few states to report its COVID-19 test results and deaths upon racial and ethnic lines, we saw that the mortality rate for people of color and for Black people in particular is significantly out of proportion with how we show up in the population. 14% of the population, but 40% of the deaths. And once we saw that trend and saw that it had been sustained, we believe that we had to take action. We also know that there have been health disparities as far as outcomes along racial lines for a long time. And this task force certainly exists in the context that we've been trying to respond to those over the long term. But we also know that this virus kills quickly. And so we believe that there are interventions that we can take that will have a direct impact on, impoverished communities and communities of color's unique and increased risk of exposure and infection, and therefore that will contribute to that increased mortality rate. So we've learned about some of the things that contribute to that increased exposure, lack of access to private cars and reliance upon public transportation, the inability to really be able to make, for example, one trip to the grocery store, then spend hundreds of dollars and instead needing to go back and forth again and again and again because you can't spend that much money at one time. A lot of our frontline workers, whether it's people who work for our energy and utility companies, people who are working to drive those buses or at those grocery stores or at gas stations, or people who are working as nurses' aides and nurses' assistants, those professionals who are working during the stay home, stay safe era, they are at unique risk of exposure, our first responders. And so we're working to make sure that we can get more testing capacity to those folks so that, again, their unique risk of exposure is not leading to more infection rates. We've also learned that there are probably protocols that we can put in place to help these people stay safe while they're carrying out their jobs to enable the rest of us to be able to stay home. So there's a lot of stuff that we are just really peeling back this onion in the context of the pandemic, but we know that there are actions that we can take to have an impact right away.
Thank you. The second question, is there anything currently being done now to help those currently at risk?
Yes. So the biggest action that we've taken thus far as a task force was announced by Chief Medical Executive Dr. Jonae Caldoun, and that was to greatly expand the testing protocol and for who was eligible to receive a test in the state of Michigan. Before it was people who had, pretty significant symptoms, and now we've relaxed that considerably to people who have very mild symptoms in the general public. And for our first responders and the people who are working.
Lieutenant Governor, I think we lost your audio a little bit there. We're having some technical difficulty here. See if we can get it resolved.
Hey, sorry, we back.
Oh, there you go. There you go.
I think my hand accidentally hit the mute button, sorry. So the expanded testing protocol that we recommended enables people with very mild symptoms to get tested, and it also enables first responders and the workers who are working to protect and sustain life. They can get tested without needing to show symptoms at all. And that expanded testing protocol will help us get a better sense of how the virus is spreading, and that will also help us design treatments based on that spread.
Thank you. Great answer. Kind of along those lines, can you tell us a little bit about what's being done to find and track and help those that are sick?
Yeah, so testing is obviously the first step to make sure that we can identify people who have been infected so they can get connected to the treatment that they need. It's also, we need to know where those folks are so that they can be served by our healthcare providers, and it helps us be able to plan how we may or may not need to scale up healthcare systems in different parts of the state. We made provision for this, particularly in southeastern Michigan, by standing up the TCF Center in downtown Detroit as an alternative care site, and the Suburban Showplace in Novi, Michigan, in Oakland County as an alternative care site. Thankfully, we have not had to utilize those systems to the degree to which we had planned for. And I believe that is, and not I don't believe, it is clear that from the science that is based upon people responding and being mindful of the stay-home orders to help slow the spread of the virus. So for people who are sick, we are ensuring that there is no discrimination in terms of how they are being treated and the treatment that they're having access to. We're working to increase the supply of things like ventilators and other different treatments that have been approved. Michigan has been, or there are trials that are currently in the field right now in the state of Michigan that are looking for clinical trials for treatments and vaccines and possible ways to help us deal with the effects of this virus. So we really have an all hands on deck approach to ensuring that people who have been identified as infected are getting what they need. I will say that one of the things that's dangerous about this virus is that it is difficult to predict how it will interact with a person's personal chemistry with their system. We do know that certain pre-existing conditions do lead to higher mortality rates. Things like if you have asthma, you're much more likely to get infected with COVID-19 because your respiratory system is already compromised. So we're trying to work to understand those things better so we can design better treatments.
What kind of advice do you have for those at-risk communities?
So a few things, and we certainly try to, from a policy standpoint, enable what I'm about to say. First is that if people are feeling any kinds of symptoms, to do their best to stay home. And we have, through expanding access to unemployment, by expanding access to paid sick leave, and by making it so that employers cannot punish or take any kind of action or retribution against an employee for having symptoms and staying home. We want people to be able to stay home and not fear for their jobs. That's one thing. The second thing is, to the extent possible, if you are feeling symptoms, or certainly if you tested positive, to try to isolate. We know, unfortunately, though, that's very difficult for a lot of people in the state of Michigan. For example, a lot of low-income people, you don't live in a house or an apartment that enables you to isolate. Like, you only have one bathroom, or you don't have a lot of rooms in your home. And so we are working to stand up the infrastructure to enable people who may not be able to afford, frankly, to self-quarantine or to isolate, to have the space to do so. The third thing is to, if you feel anything or have a question, to call your doctor or your primary care physician, or frankly, call the Michigan Department of Health and Human Services if you have a question. We don't want people to suffer in silence. There are already a lot of people who are feeling alone because of the social distancing that we've had to implement, but we don't want you to suffer in silence and suffer alone. So please, if you feel anything or have a question, please call your doctor. That is the first step to getting connected to care.
Thank you so much. Next question we have brought in was, what is the action to reduce these disparities?
I think there are several possible ones, and we are certainly deliberating those. Actually, we had another task force meeting earlier this afternoon where a lot of great ideas came up. I'd say they're falling thus far into a few buckets. The first is expanded availability and accessibility for testing. When it comes to availability, that's why we've greatly increased the number of people who are eligible in testing by limiting the restrictions on people with certain types of symptoms and expanding it to all of our workers that are protecting and sustaining life. But we also are working on models to scale up models and experiments that have already been in place to deliver tests to people directly. So whether that is taking it to nursing homes, taking them to places, homeless shelters, churches, et cetera, like sort of taking tests where people are rather than them having to go and seek out a test. Also looking at how we can connect people with physicians to be able to authorize those tests. Some people who don't have access to care need help to get that access. And so making sure that doctors are available and working on the incentive structure to make that more possible. So that's one bucket. Another bucket is on how we can make sure that once people have been identified as infected, that they do have access to care that's close to them. So they can get to a facility that is not overrun, where they will be able to get the attention that they need and adequate care. The third thing is, another bucket is on dealing with people's higher or potentially higher risk of exposure. So I mentioned this a little bit earlier, those frontline workers, bus drivers, People who by the nature of their job have to come in contact with a lot of people are first responders. And so by increasing the testing protocol for them, we're giving them more access to understand their status, but there also may be actions we can take in terms of recommending the sanitization practices or how shifts need to be designed or staggered, et cetera, to ensure that we are limiting people's structural increased risk of exposure.
Thank you. What is currently known about the differences in disease risk and fatality rates?
Well, this is something that's evolving, and so I'm not a infectious disease expert, so I don't want to. I'm not going to swim in too deep of waters here. But what's important to understand, and what is frankly dangerous about this is they call this the novel coronavirus because this is a new virus. This is a virus that medical professionals and researchers are only beginning to understand. And so, in addition to not having an approved antiviral treatment or vaccine or cure, we're still understanding the characteristics of this virus and how it spreads. And so with that, it is, again, as I mentioned earlier, difficult to predict exactly how it will intersect with a particular person's body chemistry or pre-existing conditions. The data from what we understand thus far has shown us that people with conditions like asthma or high blood pressure or diabetes those mixtures have tended to be more lethal, but we don't know that definitively yet. That's still mostly anecdotal. So, I mean, in general, people who are healthier, we would hope that they will be able to handle this. But also, people have lost their lives who have been perfectly healthy otherwise, but then fell ill to COVID-19. So, we're still learning about this, and that's part of that unknown is part of what makes this so dangerous and why the stakes are so high for people to do what they can to stay home and stay safe.
Absolutely. Next question. What resources has the state of Michigan set aside specifically to assist minority-owned businesses?
Yeah, I appreciate this question because one of the things that I have been thinking about specifically when it comes to the state's COVID-19 response has been how we are supporting small businesses in the state of Michigan to be able to get through this pandemic. I mean, things like, for example, working with chambers to support the local restaurants that are able to still be open and make their food available via delivery or safe carry out. Has been something really important to me, or doing things like supporting and launching the Michigan Paycheck Protection Program, which built upon the federal program. I launched that with my predecessor, former Lieutenant Governor Brian Calley, and the state of Michigan received about $10 billion worth of loans that went to about 27,000 loans were given out from that program, and about $10 billion worth in the state of Michigan, which sounds like a big number, but we have so many more businesses. There's so much more capacity that we are still working, and we're advocating to the federal government, which I believe actually the Senate is debating right now, another coronavirus relief package that would include about $300 billion more for the Paycheck Protection Program because it ran out of money last week. So working for that. Now, specifically when it comes to minority-owned businesses, the Michigan Economic Development Corporation has set aside some specific funds and specific programs to support minority-owned businesses during this time. There was also $20 million, $10 million in grants and $10 million in loans approved by the Michigan Economic Development Corporation, MEDC, to be able to support small businesses in all parts of our state. So we have some mechanisms in place. We also want to make sure that people, frankly, are calling their banks that they have a relationship with and letting them know what is happening, what the reality is in their business. And then, frankly, we're challenging banks to step up to help the small businesses that have helped make their businesses work.
Thank you. Next question. What do you imagine life post-COVID-19 will look like? And what are the three most important things we can do in looking to the future?
Yeah, I mean, this is the big question. When I think about life post-COVID, I think actually is all of the measures that we're taking, the social distancing, the slowing down and pausing activity. I think this is really reminding us of, frankly, how connected we all are as individuals and as communities, and how much we depend and rely upon those relationships, and how much we love and depend upon the small businesses in our community. And I think when we're coming out of this, we're going to be a little more mindful of that. We're going to check in on one another more as individuals. We're going to be a little more passionate about supporting those businesses that exist in our neighborhoods. I think we're gonna just care about those relationships more and value them more, because we had to hit the pause button on them, in order to safely respond from a public health perspective to this pandemic. When thinking about how we get to that new normal, there's a lot of infrastructure we need to build to be able to safely make that transition. That infrastructure really has three components. The first is a significant increase in the testing capacity across the state of Michigan. We need more tests everywhere so that we can understand community spread and design interventions that respond to that community spread. We still don't have enough testing kits and testing kit components from the federal government, and we're working to secure those from FEMA and other sources. We also, frankly, are trying to procure testing kits and capacity from the private sector, from other vendors from around the country and around the world. It's been difficult. We are increasing our supply, and that is why we are able to expand that testing protocol. But we need more testing. The second thing we need to get to that new normal is the ability to do something that's called contact tracing. What that means is if a person tests positive for COVID-19, we need to be able to then work with that person to understand who they've come into contact with and potentially may have exposed to the infection so that those people can also get tested. That's, again, how the virus spreads from person to person to person. That will require a significant amount of infrastructure, technology, and person power. We've trained thousands of people to be able to do this in the state of Michigan, but we still will need more capacity in that regard. The third thing that we need is capacity for people to be able to isolate. And I talked about this earlier. For people, if they've tested positive, to be able to safely isolate so that we can truly contain the spread of the virus. Those three components need to be present in all parts of our state so that we can then think about what an approach to re-engaging sectors of our economy or regions of our state in whatever our new normal is going to be. We need that in order, we need those three things in place to be able to do that responsibly.
Thank you. Thank you. Next question. What opportunities do you see arising with the reopening of the economy?
I think there are going to be a lot. I think that certainly this era is going to, lead to some key questions for business owners. I think a lot of business owners are rethinking, for example, how they manage their staff and teams. All of this working remotely may lead them to understand that maybe their people could work remotely all the time, or at least more of the time. It may cause business owners to rethink the necessity of some of their physical assets, which could lead to, very different balance sheets and very different cost structures for their business models that could lead to more nimble things. I think new business models are going to be born from the creativity that has been sparked by this emergency. And so that's difficult to predict, but I bet some exciting things are going to come from that. I think that, frankly, we're going to have managers who now will have a different skill set because they will have had to manage people working remotely for the first time in their careers. I think that certainly this pandemic and our response to it has highlighted the fact that there are a lot of households that still are not connected to the internet in the state of Michigan. And as we connect more households, we will deliver or develop more business models for internet service providers in both urban and rural communities to find better ways to deliver that service to people. So I think that more connected community will also lead to some innovations that are difficult to predict, but I think will be very valuable. So I think that on the other side of this, our businesses will look and feel different, but they'll operate perhaps in a better way.
Great. Stronger, hopefully.
Absolutely.
Last question we have for you today is how can people advocate for themselves? If a person feels like they have not received adequate care, what resources are available for them to turn to?
Yeah, please. Michigan.gov/coronavirus. We have a hotline, a number that you can call the Department of Health and Human Services. And if you give me a second, I'm going to give you what that phone number is. I'm looking it up right now. It is 888-535-6136. That's 888-535-6136. That's the number to call. It's our COVID-19 hotline at the Michigan Department of Health and Human Services. If you have any questions about anything, you call that hotline and we'll connect you to the help you need.
Thank you so much, Lieutenant Governor. This has been very informative, and we know you're a very busy man, so we appreciate the time.
Thank you for having me. Y'all stay safe.
Yeah, you too.